Hey, everybody. Hey, Ansel Lee here. Hey, welcome to another edition of Ansel Lee Live. And here we're doing another session on our fuel series. And hey, before I introduce our guest, I want to acknowledge and recognize my special partner, son, and all-around great guy, Ansel Four. Ansel Ford, welcome and helping me.
Hello, everybody. Thank you for having me on here, Dad. Rand, great to see you as always.
Hey, and our special guest today is Rand Ragusa. He is the co-founder and president of QuickTake Health. And hey, welcome, Rand. Good to have you, man.
Thank you, Ansel. Appreciate it. Look forward to the conversation.
Yeah. Hey, so give us a little thumbnail of of your background, if you would, Rand.
Sure. No, happy to. Thank you. So yeah, I have been in the health IT space for almost 15 years now, and I started my career in health IT launching a cloud-based electronic health record company called Better Day Health back in 2010. And it was a startup that both my brother and I started. And he is 17 years younger than me. He's a physician. And we really set out to create a better documentation platform for physicians. And so, it was there that I really learned about, just how far behind from a technology perspective healthcare is to other industries. So much so that, health systems are still using fax machines to communicate with one another. And, maybe the only industry in the world that still uses fax machines. But it was there that, I saw that there was an opportunity to improve the working conditions for healthcare providers, because you have, and you still have not only doctors that are, spending 6 hours a day with a computer, to be able to do their jobs, and that's not why they went to medical school, to be data entry clerks, but that's what their job has become. They meet with a patient for 15 minutes. And then they spend 30 to 45 minutes doing all the documentation.
Right.
So it was, there that I learned about burnout amongst healthcare providers.
Yeah.
And that there was a huge opportunity for innovation to try to, use automation and, technology to actually improve healthcare providers' jobs. So in 2020, when COVID first started, I actually left the company and started a temperature check kiosk company that automated the temperature check at the screening stations.
Right.
And Ochsner Health was my largest customer. They bought 70 of these units from me. And it was there that I learned about the power of contactless technologies. These thermal imaging cameras could read your temperature from up to 6 feet away.
Right.
And not only, could it do that, but it also had facial AI technology that could tell whether or not you had a mask on. And so when you think back to COVID, you think about, when you entered into a building, there was a person standing there that was scanning your forehead with a handheld thermometer.
Yep.
During a pandemic.
Right.
So not socially distanced, literally 1 foot away from you.
Right.
That was the worst job you could have during a pandemic.
Yeah.
And so selling this kiosk and seeing the reaction of those staff members when I introduced the kiosk and the fact that they weren't going to have to do that anymore.
Right.
I mean, I literally got hugs and high fives And, people just couldn't believe that they, weren't going to have to essentially do that repetitive, time-consuming job anymore. And so, fast forward, 2022, COVID started to wane. And one day I walked into one of the clinics at Ochsner, and I noticed the temp check machine wasn't there anymore. And so I walked up to the front desk and I asked the person, where's the temperature check kiosk? And
Right.
he said, well, we're not checking temperatures anymore. And so I knew, that being my biggest customer and Ochsner Health in New Orleans and Louisiana, if Ochsner wasn't checking temperatures, then really nobody was going to be checking temperatures.
Right.
And so I essentially had to pivot. And it just so happened right about that time, my wife had taken our son to the pediatrician, and she came home and told me about this paper-based process.
Right.
That the clinician was literally writing our son's vital signs numbers down on a sticky note on the wall.
Right.
And so I asked her, look, the next time you go, please, take some photos. I want to see exactly what you're talking about. And fortunately, she came home with a video. And it was a video, where the clinician literally had the sticky note in her hand the entire time, had the pen in her other hand, and she was operating, the weight scale, the height measurement bar, the handheld thermometer. And it was that was the light bulb moment for QuickTake, which was, here we are in 2022, the digital age, and we have frontline healthcare providers that their job, 50, 60 patients a day, is to write on a wall using pen and paper. And, the technology exists that would allow us to not only capture that data digitally, but to also pre-populate the electronic health record, so that the clinician wouldn't have to touch anything.
Mm-hmm.
And so that was really the inspiration for starting QuickTake Health.
Wow. Well, that's awesome. So maybe you just told us, but tell us what does QuickTake Health do?
Sure. So we created a vital signs automation documentation platform. It's a scale that you step on. It also has a 32-inch HD touchscreen. That's the main feature of the device. And so today we capture height, weight, temp, and BMI as a 1.0 product, our MVP. 2.0 is going to also have EKG. So we're adding a 2-lead cardiomobile device. And then we're also adding a pulse ox heart rate fingertip device to the front of the kiosk.
Yeah.
And so that's going to be 2.0. And then, the question that everybody asks, which is, what about blood pressure? Right now that still happens in the exam room.
Right.
So the best practice for blood pressure is that you're sitting down for 3 to 5 minutes. And so that's really not part of our workflow today. But there is some technology coming out that utilizes advanced cameras that can tell the difference of the changes in the blood vessels in your skin. And then they use AI to back into a blood pressure number. So cuffless blood pressure is on the horizon. Mm-hmm. There are about 5 to 6 companies that are vying for FDA approval right now. And so, the plan is to incorporate blood pressure too in the near future.
Wow. That is absolutely incredible. And I know, you kind of gave us through the entire origin of that, kind of going through, just how healthcare is behind in a lot of areas compared to literally everything else. Talking about still using fax machines. And so, changing the landscape in that regard, just getting everybody caught up. But how do you see this really kind of progressing? How do you see this changing the workflow? How do you see this changing the whole landscape of how doctors can operate in a more efficient environment?
Mm-hmm. So, right now, we are in the nursing station. So our device is right next to the traditional vital signs equipment. But it's this idea of being able to communicate to the patients in a very much a Trojan horse type of setting where you've never walked into a nursing station and seen a 32-inch HD digital screen. Mm-hmm. And so this idea of communicating to the patient literally seconds before they walk into the exam room is extremely powerful. And so if we know, for example, what the chief complaint is, which is the reason why the patient made the appointment, then we can serve up patient-specific content right there at the point of care that they can simply just scan a QR code and download that content. Let's say, for example, a patient education leaflet. They can download that content right to their phone. So today, when you go see the doctor, you have to go, after your doctor visit, you have to go log into your patient portal, and you have to go find that patient education material. Mm-hmm. So in the future, we're going to be able to, and how many people actually do that? So, probably, less than 20% of all patients actually go log into their patient portal and go find that patient education leaflet that's specific to, either their diagnosis or their treatment plan.
Right. Yeah.
So we believe from a patient engagement perspective that we're absolutely disrupting the method in which patients, become informed, and hopefully will actually increase adherence because of that, because the fact that they do have the information that they need, and that is actually being read or shared with their loved ones, because it's on their smartphone.
Mm-hmm. No, yeah. As opposed to having to go through, thing after thing after thing to get it, where people are just dropping off. Once you get to the next step, you have another group of people dropping off this, that, and the other. So just being able to pull your phone out, take a gander at it, and be like, this is how I look. It gives the people who don't might think like, oh, the doctor didn't tell me this is bad, so why would I go check it on my own?
Yeah, and this idea of being able to leverage other historical data, like previous treatment plans or previous diagnoses or prescriptions. If we have access to that data in the electronic health record, then we can serve up patient-specific content that isn't being done today.
So we've just got a couple more minutes here. So you see this working with the EMR, their existing EMR, correct?
Correct.
Somehow working with either the hospital or the clinic, surgery center, EMR, EHR. Is that your strategy with this product?
Yes, yeah, that's correct. In fact, that was really the motivation behind starting the company, because I knew that finally, after a decade of the government really putting incentives in place to encourage these electronic health record vendors to allow third-party companies like a QuickTake Health to actually share their data into that system. It's called interoperability, and it's actually possible now, whereas 5 years ago it wasn't possible.
Yeah, no, we've made some great strides doing that. I actually was the regional extension center executive director for our state to take especially primary care to electronic health records, rural hospitals and critical access hospitals. So yeah, no, I think we're getting there. So, but I also think this pandemic has given us a push forward to adopt technologies that have been lagging. And just like what you say, I mean, you're right. I mean, I remember going into the hospital, going into clinics, and boom, they're checking my temperature, or I'm standing in front of your kiosk, you know, and they're telling me I don't have a temp. I'm okay to go. They give me a little, it spits out a little sticker and I stick it on me, and away I go. And it's great. It was a great thing. So I'm excited about what you're doing. Hey, tell us just real quickly, you know, how's it going in the fuel, going through the fuel accelerator in Bentonville? What has that meant to you?
It's been incredible. We've been here for 6 weeks. We have 4 more weeks to go, and you know, every week it's Tuesday through Thursday. You know, it's action packed. We have workshops in the morning, and then in the afternoons we have these one-on-one mentor sessions.
Right.
And then in the evenings we have these networking events. And so it's just been an incredible experience. We learned so much. You know, it's one of those situations where, you know, sometimes, you know, you don't know what you don't know, right?
Right.
And so having these subject matter experts being willing to help, you know, us as a entrepreneur and a startup community has really been phenomenal. Tom and Darian did a great job of coordinating all of the different functions that we attend.
And you made a comment to me in the green room before this that I thought was astounding. I'd love for you to repeat that. What this has meant to you, as a startup.
We had a workshop last week that was 3 days. It was a gentleman by the name of Albert Bear, and it was life changing, is how I described it in my email to him when I thanked him for, you know, sharing all of his wisdom and real life examples. And it wasn't all about what we should be doing as much as it was things that we shouldn't be doing. And you know, he was speaking from experience of 30 years and, you know, helping companies succeed. And so, yeah, I mean, it's that kind of exposure that's really invaluable, you know, and the big part of why I'm here in Bentonville is to be educated on those types of topics. And so, yeah, it's been one of those life-changing decisions that I made to commit to 10-week accelerator, and I'm glad I did it.
Wow. Now I see that there's nothing like being there and being part of all that. And so, hey, so awesome. So, hey, how can folks contact you? Find out more.
Yeah, no, we have our website is QuickTakeHealth.com, and I'm on LinkedIn, Rand Ragusa, and you can also message me there.
Awesome. Hey, Rand, thank you for being on here today. Anything else you want to share before we call it a day?
No, I just, I live in New Orleans, and I've fallen in love with Bentonville.
Yeah.
It reminds me a lot of one of those quaint ski towns in Colorado. It's very much kind of like an Aspen or a Breckenridge. You know, it's kind of have a very much a small town feel, but the energy and the big business that's happening here is incredible.
Yeah. No, I totally agree. Great way to put it.
Absolutely.
Listen, Rand, great to thank you for being on here today. I wish you all the best. Let us know how we can help you. And hey, folks, if you can't remember how to get in touch with Rand, hey, message me and I'll connect you directly to him. So, hey, thank you all for being on today, Rand. Thanks so much. And we'll keep going strong, and we'll see you at graduation.
Thanks, Ansel. Appreciate it. Have a great day.
You too.
See you, Rand.
Bye, guys.